Okay, let's have the definition of the cirrhosis of the liver. You know, it is the end stage of the liver. End stage of liver. Okay, and it is a diffuse disease in which the hepatic lobule get disappear, and the nodule formation takes place. And the nodule are separated by the fibrous septa. The nodule are separated by fibrous nodules are separated by fibrous. Okay, it occurs in the entire liver, not only to the part of the liver. For example, look at this. Yes, this is a liver. This is a liver. The cirrhosis of liver does not only occur at this part, but it involves cirrhosis of liver involves the whole entire liver. This hope you understand the definition of the cirrhosis of the liver. Basically, once again, I am going to repeat it that cirrhosis of liver occur in the entire liver. Remember that, and then the lobule structure of the hepatocytes. This gets disappear in appearance of the nodule. Nodule formations takes place, and between these nodules, these are separated by fibrous band. Okay, this was the definition about the cirrhosis of the liver. Let's move about the pathogenesis of the cirrhosis. Okay, let's discuss about the pathogenesis of the cirrhosis of the liver. Primary, any injury occur which causes the destruction of hepatocytes. Okay, then due to the destruction of hepatocytes, the normal lobular hepatic parenchyma get collapsed. Okay, lobular hepatic parenchyma, normal lobular hepatic parenchyma that gets collapse. Okay, due to this, the stimulation of the etro cells get converted into the myofibroblast. And these start to synthesize the collagen. This is stored in the space of this and get due to storage of the collagen, the fibrosis of liver occur. Fibrosis takes place. So this was the pathogenesis of the liver cirrhosis. First of all, injury occurred, then the destruction of the hepatocytes, then the normal lobular hepatic parenchyma get collapsed, etro cell converted into the myofibroblast. Myofibroblast start to synthesize the collagen. Due to storage of the collagen, the fibrosis occur. So this was about the pathogenesis of the cirrhosis of the liver. Okay, we have done the definition of the cirrhosis, the pathogenesis of cirrhosis. Let's move toward the classification of cirrhosis. There are the two types of classification. Okay, let's start the classification of the liver cirrhosis. Classification. There are the two types of classification. morphological classification, and other is etiological classification. Morphological classification. In morphological, there are the two types. First one is a micronodular cirrhosis, and second one is a macronodular cirrhosis. Micro nodular cirrhosis, and other is a macronodular cirrhosis. Macronodular cirrhosis. Okay. In micronodular cirrhosis, if nodule is less than 3 millimeter, this is the micronodular cirrhosis. If nodule is greater than 3 millimeter, this is macronodular. Okay. Then others etiologic classification. In etiologic classification, almost 70% alcoholic cirrhosis occur. Alcoholic cirrhosis. Okay. Post necrotic cirrhosis. Okay. Biliary cirrhosis. Wilson disease cirrhosis. Wilson disease cirrhosis, etc. Remember that only the post necrotic cirrhosis and Wilson disease cirrhosis, these both are the macronodular cirrhosis, while the rest all are the micronodular cirrhosis. Okay. I'm going to repeat again the classification of cirrhosis. There are two types of classification. Morphological classification and etiological classification. Morphological classification, there is some are the micronodular cirrhosis, some are the macronodular cirrhosis. Okay. Micronodular cirrhosis, first remember micro, less than, if nodule is less than 3 millimeter, it is micronodular cirrhosis. Macronodular cirrhosis, if nodule is greater than 3 millimeter. Okay. Then other is etiologic classification, and there is a alcoholic cirrhosis occur. This is 70 to 80%. Post necrotic cirrhosis is due to the hepatitis BCD then which convert to the cirrhosis of liver or HCC. Okay, this post necrotic cirrhosis. Biliary cirrhosis and Wilson disease cirrhosis. Only the post necrotic cirrhosis and Wilson disease cirrhosis. These both are the macronodular cirrhosis, while the rest all are the micronodular cirrhosis. Okay, hope you understand the classification of cirrhosis. Let's move to the clinical features of cirrhosis. Okay guys, let's move toward the clinical features. Normally in the liver, ammonia convert into the urea, but in the liver cirrhosis, ammonia cannot convert into urea. So the increased concentration ammonia, hyperammonia, leads astraxia, confusion, and coma. Gluconeogenesis. Number 2, gluconeogenesis also occur in the liver. In the liver cirrhosis, gluconeogenesis does not take place. It leads hypoglycemia. The metabolism of the bilirubin also takes place in liver due to loss of the metabolism of bilirubin. It leads jaundice, and clotting factor also synthesized by the liver. In the liver cirrhosis, the clotting factor cannot be synthesized, and this lead coagulopathy in which PT and PTT time period get elevated. Albumin synthesis also takes place in the liver. So in the liver cirrhosis, there is a decreased concentration of albumin, hypoalbuminemia. It leads low oncotic pressure, which leads ascites and edema. Normally, estrogen is removed by the liver, but in a liver cirrhosis, the estrogen cannot be removed. There is increased level of estrogen. It's lead, it leads gynecomastia on the man, spider angiometia, and palmar-erythema. There is a redness in the thenar and hypothenar portion. Palmar-erythema, portal hypertension. If patient has liver cirrhosis but patient does not have portal hypertension, it doesn't lead ascites. So there is a if ascites occur, it means portal hypertension is present in the liver cirrhosis patient. Some conditions which are correlated to the portal hypertension, like edema, like a caput medusa occur at esophagus, esophageal varicosis, at the rectum, internal hemorrhoids, and also there is a low platelet count in the liver cirrhosis. These are the clinical features of the liver cirrhosis, like the hyperammonia, which leads astraxia, confusion and coma, hypoglycemia, jaundice, coagulopathy, ascites, edema, and gynecomastia on the main, spider angioemeta, palmar-erythema, portal hypertension, due to collateral portal hypertension, caput medusa, esophageal varicosis, and internal hemorrhoids also occur. There also occur low platelet count also takes place in liver cirrhotic patient.